you went, nevertheless, to your surgical rotation in Italy. And if I'm not mistaken, you went using the International Federation of Medical Schools Association, IFMSA, services,
Yes.
which is, I believe, linked in Brazil to CLEV. Am I correct about that?
No, they're not linked. CLEV is a one organization, IFMSA is another one.
And
They are
so,
different.
so how does it work? Did you contact them directly, or did your university do the proceedings?
Basically, we have a committee, a local committee in the university. So this is how they work in general. I think your university needs to have an IFMSA committee locally, and then they do the connections. This is how it worked for me. I'm not sure if someone who is in a university that doesn't have a committee, a local committee, if they can apply regardless of having the committee or not. Certainly, it makes it a lot easier to have a committee because they help you throughout the process. They help you to apply, they help you giving instructions and everything. So in my case, I'm going to say the process was kind of like fluid, but it was not easy because it's a lot of things. It's kind of those things that are easy, but it's a lot of work. It's kind of like there's not a lot of things go wrong, but you have to have patience, to get the documents, get everything that they need, be always aware of the dates, because we have a lot of deadlines to basically meet. So we have to meet deadlines for a lot of things. So it is a very intuitive process, I would say, and it's very organized. IFMSA, I don't know about CLEV, but IFMSA is very organized. They answer fast if you send them an email, for example. So I think it was very easy, but it was a lot of work,
Sorry. I thought they were the same thing. I'm not sure why.
Yeah,
But
because they focus on the same thing, basically helping med students to have exchange experiences. But IFMSA is different. I can talk about the IFMSA process if you want, very briefly. Basically, do you want me to?
go ahead.
Okay. So basically, they have a list of countries and spots that they have for each country. So, for example, Italy, we have 5 spots for July. And then they put, I don't know, like Argentina, 2 spots for May. And then there's literally a list of countries, months, and number of spots that they have for each month. And then you have a platform, an online platform, where you do your application. And then in that platform, you're basically gonna insert any certificates that you have. They have specific areas for each thing. So you can choose 10 countries and months, basically, based on your preference. And then you're going to put your certificates, you're going to put many things that help you to get points. So basically you go to the place that you pass based on the points that you get, based on your score. And that score is based on things that you have done in your life. Papers that you have presented, or anything that you're involved with in college, any projects and things like that, they count. So you submit that application, and then they give you the results after some time. You pay a fee. I think it's 120 reais. You pay the fee and you apply. And then a couple of weeks after, I think, they give you back the results. They basically have a list of the people that were approved for each country and which month they were approved to go. All the exchange experiences are 4 weeks long. It's always 4 weeks. They give you back the results, and if you have not been selected, or if you've been selected to a country that you don't want to go to because you chose 10 countries, you can apply again for the remaining spots. So after people have accepted the spots that they got, there's still remaining spots, and then you can apply again. And then you keep applying until you get the place that you want to go to. Basically, that's it. And then when you are accepted based on your score, you already are kind of assigned to that country. And then that hospital, that country has specific hospitals that are linked to IFMSA. And each hospital and each local committee, like I have in my university, each local committee has their own requirements. So then you have to follow their requirements after you have been selected to go there. And then each country will have their own requirements. For example, in my case, I was not required to speak fluent Italian, but I was required to have a B1 or B2 level of English. So you need to attach, for example, an English certificate. It could be TOEFL, Cambridge. They give a list of tests that you can upload. And basically, you have many things that you need to provide. So, for example, health, insurance you need to have, your vaccination card, and things like that. But that part, as I said, is not difficult. It's just annoying. You need to come up, you need to provide them with a lot of documents. It's, a lot of work, but it's not hard. And they are very understanding, depending on the people that are going to have you there. They are very understanding. They wait. If you are not able to get the certificate on time, they will wait for you. They're very easygoing after you pass. And then you pay another fee, which is, I think, 500 reais, and that's it. And the very nice thing about IFMSA is that someone will host you in their home, or the university will provide a place for you to stay. They will have like a student dorm, for example, which was my case. So they will basically give you a place to stay and 1 meal per day. In my case, they gave me like lunch tickets. So I could have lunch every day at the university canteen, for example. And, that was very nice. But the thing is about my committee, and I think the regulations that I had to follow was I need to host someone for 4 weeks. Someone who is like, so it's kind of like a give and receive experience. So you receive a place to stay, you have all of that, but then you also have to give someone a place to stay. So it's kind of like literally an exchange thing,
the legitimate exchange program by the letter.
Exactly. It is legitimately an exchange. So in August, I'm actually hosting a Portuguese student, which is very nice because she speaks our language. So it will be nice for her to be here, and she will not go through a lot of the challenges that I had to go through in Italy, because not everyone speaks English, and it was difficult for me to get by. But in her case, she speaks Portuguese, but I'm going to host her in my home. So basically, that's how IFMSA works.
What you've mentioned sounds a lot like the process I'm used to, so I'm still not convinced IMSA and CLEV are not the same thing. Because it really sounds a lot like, I tried it once, I wasn't accepted because there was some kind of score, and actually hosting someone scores really high. So unless you host someone, you couldn't get enough score to go anywhere. And
Okay.
I'm not sure how if it changed or if it's a different organization because you went first and you are going to host later. But I did
Yeah.
have some experience with it, even though I wasn't selected, because for 4 months, for example, I lived with a colleague of mine who hosted two people who came through this project. So they
Mm,
were a female Portuguese med student and her
nice.
boyfriend, a Dutch med student. I think that was that. And it was quite fun because actually she was the hosted one. She was in the program and he accompanied her, I believe. So he
Mm,
actually paid my colleague to stay at the house as well.
nice. That's
His
nice.
girlfriend was staying through the program, but he came together and stayed by actually paying rent.
That's nice.
And it was an interesting experience. That was, I think, like 2017 or 2016. And we did get the chance to talk a lot. We had some dinners together. And it was interesting. She spoke Portuguese, of course. She was Portuguese, but he was Dutch. So usually when we were all together, we spoke in English. And he even spoke French. So we once
Wow.
went to, we once went to dinner and we started talking in French during dinner.
Wow, that's nice. That's nice.
And that was a dinner we talked in French. I didn't speak Dutch. I believe not even his girlfriend spoke Dutch. So
Yeah.
no one there was speaking Dutch. But I did have some experience with this program, even though I wasn't technically the host. I was cohabitating with them, and
Yeah.
I didn't get to go. But I saw this sort of program happen a lot in my university, and I saw a
Yeah.
lot of people host people and also go to other countries. So
Nice.
it is interesting. It is an interesting program, and
It
I'm,
is.
as I said, I'm still not convinced it's not the same thing. I believe we're probably talking about the same program.
They're very much alike. I think, just because they have the same purpose, basically. So they are similar.
But you've mentioned, I talked about the languages, and you've mentioned they don't require fluent Italian, for example. And that's a kind of problem I've heard from some people that went to study abroad. People go to study in Russia, in Greece, for example, France usually requires French. But
Yes, French, yeah.
many of the countries that have less commonly spoken languages, like for example, if you go to Bulgaria, people don't usually expect you to speak Bulgarian. The same applies for
Yeah.
many other countries. So perhaps
Mm-hmm.
France and Germany require French and German, but many countries don't require their own languages. They require only
Yeah.
English. And you can
Yeah.
be too strict, but you can also be too lenient. And what many people have said is that they go, for example, let's say, to a random country. They go to Romania and they don't
Yeah.
speak Romanian, and the requirement is to speak English. And of course, they won't be denied, but no patient speaks English. So they can actually collect history, for example. What was your
Exactly.
experience like in Italy? Did patients speak English? Did
No.
rounds happen in English? How was it?
No. No. People were so nice to me, doctors and students. And the doctors and the students, all of them, they spoke English, but not patients. So rounds and consults and things like that were all in Italian. And then afterwards, they would explain to me what was said. This is not something that made my experience bad or anything like that, but I think I would have had a much richer experience if I spoke Italian. One of the exchange students that was there, he was another Brazilian student as well, and he spoke Italian. So I think for him, the experience was richer, definitely, because he could understand patients and things like that. So yeah, it's very nice. If you can learn the language, if you have time to dedicate yourself to that, I think it's amazing. It's not fundamental if they don't require it, but I think it makes your experience much better. And I actually want to learn Italian. It kind of like triggered something in me being there and stuff and seeing the language in person and being Italian and not speaking it. It makes me so sad and even a little bit ashamed, but I do want to learn, and I think this experience definitely triggered something in me.
We also had an Italian, a recent graduate. She had just become an MD, much like you,
Nice.
come to my university when I was on my surgery rotations, and she had just
Nice.
graduated, and she used these programs to come and spend like another month here, exactly because she wanted to do procedures. She came to Brazil precisely because she wanted to try her hand at suturing or getting a central line and these kinds of things. And personally, I don't think it worked very well for her because it was a university hospital, so there are lots of students.
Yeah.
Usually, when you go to some random hospital where they actually need workforce, they are more accepting to procedures. Usually, when you are at university hospital, you have a any kind of remotely interesting procedure. If you're going to place a central line, there are usually 8 students waiting for the opportunity to do it. So personally, I don't think it
Yeah.
worked that well for her. But at least
Yeah.
she got to know Rio de Janeiro and our
Yeah.
hospital, Gafrengili,
That's
was,
nice.
I bet it was a valid opportunity.